Tierra Walker just died because of Texas's abortion ban. Abortion bans increase maternal mortality, and they destroy families. Tierra Walker would be here and alive with her 14-year-old son were it not for Texas's abortion ban. Tierra Walker started her pregnancy in the hospital. She went on a walk with her son and was having such a hard time breathing, she went to the hospital and found out she was 5 weeks pregnant. In states that ban abortion, patients with chronic conditions and other high-risk pregnancies have nowhere to turn. They enter pregnancy sick and are expected to get sicker. As her first trimester continued, she kept seizing. Her body convulsed and her eyes would roll back for up to 30 minutes at a time. For 3 weeks, she stayed in a hospital and they weren't able to determine the cause. Tierra Walker called for a doctor while she was hospitalized and asked about ending her pregnancy for the sake of her health. They said, when we get you under control, then everything will go smoothly, which is not how health conditions in pregnancy work. ProPublica had multiple maternal fetal medicine specialists review Tierra Walker's medical notes and conditions. A doctor in Michigan said that a physician comfortable with high-risk pregnancies should have counseled her on the dangers of continuing and offered her an abortion. The safest thing for her would be to terminate this pregnancy. At 12 weeks pregnant, she was already developing clots in her leg that needed a surgery, a thrombectomy, to remove it. At this point, they've gone from complicated to we've got someone with a major procedure in pregnancy that tells us something isn't going well. In my practice, we'd have a frank discussion about whether this is a person we'd offer a termination to. None of this was offered to her. At an appointment around 20 weeks, a doctor noted spiking blood pressure and sent her to the ER where she was given a diagnosis of preeclampsia. Her blood pressure was 174 over 115. A normal blood pressure is about 120 over 80. Most of the people who reviewed her records questioned her doctor's choice not to label her condition as severe. The treatment for severe preeclampsia is delivery, or at 20 weeks, an abortion. Instead, doctors lowered her blood pressure with medication and sent her home. And at home, her son found her lying face down on her bed, ran over, and he tried to find any signs of life. He called 911 and a dispatcher coached him to slide her to the rug and start CPR. "I need you," he shouted as he leaned over his mom, pressing down on her chest. "I need you." The autopsy found that the fetus was indeed healthy, but it showed that Walker had hypertensive cardiovascular disease with preeclampsia, along with an enlarged heart, dangerously full of fluid, and kidney damage.